Hello and welcome to the Introduction to Q Essentials, NAHQ's Essential Competencies for the Healthcare Quality Profession. This event is for members of the National Association for Healthcare Quality, also referred to as NAHQ. Our running time will be about 30 minutes with time for questions and feedback at the end. This webinar is being recorded and all of your lines are muted. Please submit your questions via the chat function found in the corner of your screen. You can submit a question for the presenters at any time during the presentation. On the line today to present the Q Essentials are three representatives of the National Association for Healthcare Quality: Mary Huddleston, President of NAHQ; Tony Heath, a NAHQ volunteer and one of the developers of the Q Essentials framework; and Stephanie Mercado, Executive Director of NAHQ. Like you, our presenters are dialing in from locations around the U.S. Now we'll open with Stephanie Mercado, Executive Director of the National Association for Healthcare Quality.
Thank you. Hello, everyone, and welcome to this NAHQ's member-only introduction of a groundbreaking initiative that is really designed for you, the professionals that are supporting healthcare quality today. Our goals for the next 30 minutes are to share news about Q Essentials, the essential competencies for the profession of healthcare quality, provide information on educational opportunities in support of the competencies, and we want to leave some time at the end to take questions and hear feedback from you to see what you think. First, you'll hear from Mary Huddleston, NAHQ President. Mary is the Quality Management Officer for Florida, Puerto Rico Veterans Healthcare System. Mary is going to give you an overview of the evolution of the competencies and explain how they are grounded in real need in the field and how NAHQ directed the development of this important work. Mary?
Thank you, Stephanie. I'm going to share a little bit of the story of Q Essentials and the important reason for their development. The people who work in healthcare quality every day, that's the reason. I'm going to start, this first slide is a depiction of the NAHQ membership as an example of who is working in quality or how we identify ourselves as working in quality, and then show you how this is changing. This first pie chart shows that 54% of NAHQ members are in management roles or identify themselves as being in management roles. Their position in this next slide, they report primarily as quality management. That's the purple segment on your screen. Quality management is performance and process improvement, quality, and leadership management as identified by the members. The other sections, as you can see there, regulatory, clinicians, ancillary department, and other. And of course, there's overlap in those. The next slide is where our members report as their primary work setting. And our members certainly are not limited to acute care, but more than half of our members report their primary work setting as acute care. Our members report themselves having often as much as 15 years of experience in healthcare or more. But the people who are doing the work in healthcare quality are changing. So, and that's what this picture, which we refer to as the quality superhighway, depicts. And as you can see, the center of that highway is the traditional quality professionals, which many of us, of course, are, but not all of us. This is showing how our profession is seeing new participants and partners come on board and changing the way that we address quality. Those on-ramps on the side of the superhighway are just that, the chief quality officers, the Lean Six Sigma experts, the data analysts, clinician providers, practice managers, and quality engineers. They have expertise that maybe not all of the traditional quality professionals bring. And so we're looking at those different skills and different perspectives that are being brought to healthcare quality. So this brings us to a turning point for healthcare and for NAHQ. As healthcare is evolving, so is NAHQ, and we have to. We've been defining some logical scenarios for healthcare quality in the future. We have a slide and a couple of slides that some of you will recognize. So we have multiple things going on simultaneously in healthcare, and we're going to share a little bit of our research in the field that was conducted a few years ago. But it's relevant because it shows the need that our members and other leaders in healthcare have identified. And then we're going to talk about how we're all coming together to work on those needs. So this is the vision for quality profession in 2017 and 18. And this is what we've heard. And we did research. This is what I was speaking to. If any of you were at the NAHQ conference a few years back and also at the Leadership Summit, we asked the attendees what was their vision for a few years out. Where will you be in 2017 and 18? And the main theme, the mega trend that was brought forward was that quality is everyone's job. We heard quality professionals lead and manage the quality programs, that we, quality professionals, are the change agents and the coaches for informed decision making, and that the scope extends beyond a single care setting and across the continuum. So then this next slide is a 2x2 matrix that if you were at the annual conference in 2013 or the Leadership Summit in 2014, you may recognize this. We talked to the participants and we asked them which of these 4 scenarios you would identify as operating in right now. And those 4 are siloed, pockets of excellence, cost control, or transformative. Only 6% believed that they operated in the silos, and we also asked them, where are you now and where do you think you will be? 6% they saw themselves in silos now, and 4% saw them siloed in the future. 30% saw them in pockets of excellence, and that dropped down to 21% in the future. Cost control was where fully 38% of the respondents found themselves, but only 15% saw themselves there in the future. And then when it comes to scenario D, the transformative, we're highly optimistic here. Only 6% thought that they were in that place, but 60% felt that they would be operating in that scenario within the next 5 years. So given this information, where our members thought they were and where they felt like they needed to be, NAHQ said, how are we going to help our members support their organizations to be transformative? So this is what we did. We tried to answer this critical question of how to help members in transformation. We started with those insights, those most likely scenarios that were described, and we put together an advisory team with representatives from across the continuum of care. We included acute care, systems, ambulatory, and payers. We researched the literature and position descriptions. We conducted interviews and took polls. NAHQ brought together leaders and hosted a Delphi panel to outline the competencies for the emerging roles of the healthcare quality profession. And then we formed work groups that used 90-day rapid cycle development to create sets of competencies for those defined areas in quality. The result of the research and the dialogue was that NAHQ began a journey to define competencies needed to meet evolving needs for the profession of healthcare quality. And Q Essentials is born, which is our next slide. Ta-da, this is where I'm saying ta-da. NAHQ defined the competencies in 6 areas. A dedicated group of volunteers came together to identify those 6 competency areas, and those are, as you can see on the slide, health data analytics, population health and care transition, performance and process improvement, quality review and accountability, regulatory and accreditation, and patient safety. And I just want to say here that we were really thrilled how excited and enthusiastic the volunteers that came together in this project were and continue to be, and it really has created a lot of energy around the process. This is a sizable range of knowledge to cover. We chose 2 areas to start with, and those are health data analytics, which is in red in the diagram, and population health and care transitions, which is adjacent in orange. In each of these 2 areas, subject matter experts created a body of knowledge necessary for the healthcare quality professional to competently execute in their area. This is represented as a comprehensive list that is an aggregation of skills, knowledge, and abilities that quality professionals use to perform their job. These are core competencies that are essential to performing the job well and that provide marketable skills for healthcare quality professionals. Now that you know how Q Essentials evolved, I want to turn the program over to Tony Heath, who is a Lean Six Sigma Black Belt for Optum. Tony served as one of the project team leaders for the Q Essentials. He's going to share the story of how the competencies are designed to serve you. Tony?
Thank you very much, Mary. It's great to be with you all. The set of 6 circles pictured here illustrates the opportunities for health quality professionals. HQPs are needed for every part of the health system, as you all know. Provider, payer, public health, research, policy, and even solution developers. Each of the 6 intersecting circles represents a cluster of healthcare quality competence. For example, a competency set for health data analytics. For this area, we define distinct skills and knowledge that rock data analytics. The areas overlap because they share knowledge and skills. Now, if you're like me, you want to know what these competencies exactly are. Before I go any further, I'd like to give you a look at a sample so it's plain what we're discussing. This tiny font shows you here an image of the spread of competency areas of health data analytics. Let's zoom in on an example. So in the dimension of data management, one sample competency or observable behavior is, in tiny print, validate the structural integrity of manual and electronic data sets. In proficiency level 1, an advanced practitioner would be able to clean, transform, validate, or model data to support accurate decision making. In proficiency 2, validation of structural integrity would mean that one would be able to design evaluation methodology to determine completeness and accuracy of data and develop processes to maximize inter-rater reliability. That was a sample of a specific competency. NAHQ developed the Healthcare Quality Competencies framework to support self-learning by healthcare quality professionals. This will help us assess and expand our competencies to better meet the changing needs of our employers or gain new skills needed for new roles. Individual interests and skills vary. The intent of the framework, a set of 6 competency areas, is for ongoing professional development to lead to mastery in one area or cross multiple areas at a time. The areas apply to all healthcare settings regardless of size or specialty. We think that this will help healthcare quality professionals look beyond our current roles, engage in learning activities focused on new or expanding functions for our own professional growth, and help ensure our success in roles in our ever-changing work environment. Toward that end, our framework is designed with these qualities. It's inclusive. All quality professionals should see their work reflected in the model, whether they are executives or individual contributors. It's non-hierarchical. quality professionals have opportunities for career progression by moving into new knowledge roles. Managerial roles are not the only route for career advancement. It's flexible. It supports a variety of uses and reflects continued evolution. It's intuitive. It should make sense to the casual reader. It's learning and professional development focused. This is not an academic pathway. We can learn on the job, attend workshops, or pursue additional degrees. And finally, it's current and future oriented. Q Essentials allows healthcare quality professionals to identify gaps and set a course of professional development that best meets their needs. So here's how the competencies are arranged. The framework is a set of 6 areas, as you see there. Each competency area, the circles in the figure, defines a collection of competencies that are relevant to performance in a particular job, job family, or functional area. With each area are competency dimensions, which refers to a logical cluster or subset of competencies. This is a descriptive label or title. A competency is defined as the specific observable behaviors or actions for which proficiency is to be demonstrated. How did we arrive at these? Task teams of SMEs were formed from the many that volunteered to help. A range of sources were used to define and describe the essential competencies at proficiency level 1 and proficiency level 2 for each model. Proficiency level 1 is an advanced level of competency, and proficiency level 2 is more advanced and specialized. Sources include position descriptions, relative research, literature, and consensus of team members. The competency framework describes 2 higher levels of competency that expand current foundational healthcare quality knowledge. Skills at the master practitioner level may be required to a varying degree by the healthcare organization, depending on the organization's size and scope. For example, a small organization may have limited data sources and not require an in-house data analytics expert. The small organization, however, may require skills in assessing the abilities of vendors or consultants to perform such functions on an ad hoc basis. As Mary mentioned in her remarks earlier about the changes in our field, professionals enter the field of healthcare quality with a background in healthcare or another industry. Proficiency can be gained bidirectionally. For example, we can earn the credential of Certified Professional in Healthcare Quality, which is foundational in healthcare quality, and then gain specific expertise in one of the 6 competency areas. I'm a CPHQ, and everything I wish I knew is spelled out by Q Essentials. Or a professional can enter healthcare quality with expertise in one or more of the competency areas and earn the CPHQ certification. CPHQ certification is very highly valued in the field, and increasingly so. The Q Essential competencies build on the foundational knowledge of the CPHQ. Now we'll hear from Stephanie Mercado, who will describe some of the support materials for education and careers that NAHQ is creating for Q Essentials. Stephanie?
Thanks, Tony. As Mary mentioned, Q Essentials is under development, and for the first of the series will be released is Health Data Analytics. The information is currently available online, and we've sent several email messages to our members about this exciting project. And additionally, as a benefit to your membership with NAHQ, you have been mailed a complimentary print copy of Q Essentials Health Data Analytics. I hope you take a few minutes to peruse it and see how it applies to your work and to your career. As you assess these essential competencies, you may choose to seek resources to help you grow professionally in these areas. NAHQ is working to support you with new educational and career advancement resources, including these that are starting to become available now. One of the examples is Learning Labs. Learning Labs are virtual learning opportunities to learn about and discuss the essential competencies, first one being data analytics. In a format similar to the one we are participating on right now, we have thought leaders and experts sharing information about topics that support your learning around the competencies. They're called Learning Labs because the plan is for these to be interactive with polls and tools for you to download and use on the job. We want it to be very practical. And because these competencies are brand new, you will be the first of the individuals to be investigating them and see how they work for you. So we're really interested in your feedback and to let us know if we're accomplishing our goals. The content of the Learning Labs is designed to support the essential competencies. For example, the first set of essential competencies released focuses on health data analytics, as we've mentioned. You can register for the July 15th Learning Lab entitled Using Quality Data to Affect Change Across the Continuum. Our presenter is a widely recognized expert in this area, and he will bring information that is tailored specifically to healthcare quality professionals. We fear that too often when you're trying to learn data analytics, examples and tools that are shared are not necessarily reflective of what you are seeing in your job and what you do in practice. Our goal is to make this as relevant as possible. Another resource for you that is career-focused will be called Q Essentials at Work. This is the place where you can find both position profiles and information about jobs. The career profiles are interesting because they tell the stories of a diverse set of active, practicing healthcare quality professionals. They talk about their backgrounds and their training and how they evolved into their careers. At the opening of our presentation today, Mary Huddleston showed you the healthcare quality superhighway, with healthcare quality professionals on-ramping from various different backgrounds. The professionals profiled in Q Essentials at Work are examples of some of these professionals, and they may give you ideas how to succeed on your own path and as that evolves moving forward. For each area, we will have resources to enhance the learning, and some of them have corresponded with the outline that you have today. Those examples are rich in learning and career-focused resources, and we're just getting started. We hope that you will visit our website to take a look at the offers that we currently have available. There are there are learning labs that are scheduled through November of 2015, so there's lots of active content available at this moment. So the release plan, it will be released in phases, and we're excited to talk about that now. So currently, health data analytics is available. Moving forward, population health and care transitions will be released in the fall, and performance and process improvement is underway. We plan for that to arrive to you early in 2016, followed by regulatory accreditation, patient safety, and quality review and accountability. As members, you can expect these printed copies to be mailed to your preferred address, and of course you always have access to this information online. I also want to talk to you for a moment about a few live events coming up that will continue to build on the foundations of these competencies and bring even more products and services and value, we hope, forward so that you can continue to grow professionally. The National Quality Summit, which was launched just in 2015, the topic this past year was healthcare transitions. We are going to be having another summit, National Quality Summit in 2016, and the topic is improving health outcomes through population health management. And that is specifically designed for healthcare quality professionals, as was our Transitions Summit in 2015. The Population Health National Quality Summit will be held May 11th and 12th, 2016, and that will be at the Dallas Hyatt Regency. We are very excited to announce that we have developed a relationship with the Jefferson School of Population Health, and we'll be working with Drew Harris, who's the program director of that school, to construct the event for our members. The live event capacity is at 300, and we were nearly sold out this year, and virtual attendance is unlimited. One note I'll make about the virtual attendance, it was interesting. We had about 275 people attending our live summit in 2015, and more than 350 attended virtually. Of those attending virtually, 96% of virtual attendees said they would recommend the virtual summit to their peers, and 96% were satisfied with the summit. These were overwhelmingly positive results, also received quite favorable results from the live attendees, and so we were just thrilled with the format and excited to bring it forward and wrap it more closely into the Q Essentials offering. Additionally, NAHQ's annual conference will be returning in the fall of 2017, and you can certainly expect that the Q Essentials competencies, along with the foundational knowledge that you've come to expect around CPHQ, will be included in that offer. The dates and location are scheduled to be announced this fall of 2015. We have taken a bit of time off from the conference, and I know everyone is super excited for it to come back, as are we, and we'll be getting those dates out just as soon as they are available. Once again, here's the information for the Q Essentials and the webpage that you can visit to get more information. We are very excited about this project, and not only because it's a groundbreaking initiative for NAHQ, but because we really think that it's going to advance the profession forward in the future. And we're very excited to hear your feedback and questions, because we've been thinking about this for months and years here at NAHQ, and it's our pleasure to debut it to you today and get some feedback. So I will turn it back over to our moderator.
We have received a couple questions so far. Our first question, Stephanie, is could you clarify when the hard copy of the Q Essentials Data Analytics series will be released?
Yes, you can expect that in your mailboxes within the next couple of weeks. I believe it dropped in the mail this week. So any time now, it should be arriving at your doorstep.
Thank you.
Oh, the next question, someone asked, can we talk about how Q Essentials will connect with Q Solutions? This is a great question. So I would say overall, NAHQ is taking an opportunity to really take a look at all of the educational products and services that the organization is offering. Of course, we have deep roots in the CPHQ certification prep space. Q Essentials is a fundamental and foundational product that we're, or Q Solutions, my apologies. Q Solutions is a fundamental and foundational project that we're very proud of. So we will be working with our education committee over the next months and years to figure out how we harmonize these products, and so that we make sure that they are serving members' needs across their entire career progression. So I don't have specific plans to share with you about the how they will mesh or how they could mesh together, but that is absolutely on our radar, and we'll be discussing that moving forward. We don't view them in conflict at all, and hope that they only have a compounding positive effect on each other.
Great. We do have another question. Will non-members be able to purchase the hard copy format of Q Essentials?
Yes, we'll be working on an opportunity for people to purchase hard copies, and that will be sort of on a per piece basis. And it is available open access on our website for free. Copyrighted by NAHQ, but available to all.
In regards to the National Quality Summit, will the Introduction to Healthcare Quality course be held the day prior or at all during that time?
You know, we did that this year. We offered the Introduction to Quality course right before that, and we had a good amount of attendance. The Education Committee will also be looking at that issue and really trying to plot out and plan all of our educational activities for 2016. So be on the lookout for more information, but I can tell you right now that there are Intro to Quality courses available at this moment for registration, and you do not need to wait for that activity, assuming that it does pair up with that again. You don't need to wait for that. There's opportunities all the time to do Intro to Quality.
We have another great question. Is Q Essentials being designed to prepare one for CPHQ certification, or is it more for continuing education?
Mary or Tony, would you like to take that question? Would you like us to repeat it?
Well, the question was, is it to help prepare for CPHQ or beyond? I would say the terminology we've been using, which I think is right on target, is that CPHQ is foundational. There are subjects within the practice analysis that, of course, are measured in the exam, and that's what the course is taught to. This is also what makes this a little bit different is we're trying to look to the future. CPHQ exam is based on the practice analysis of currently practicing professionals. We're trying to help bridge that gap of where you are now and where you will need to be in a few years So that's where we're trying to bring Q Essentials in. They work together. You more or less need one before you get to the other, but I would say the CPHQ course is more foundational.
Yeah, so we have, if I could add on to that, NAHQ does have a good offer in terms of the CPHQ prep product. So we have an online course, we have live prep courses, there's self-assessments where you can test your knowledge. Those are really designed for CPHQ exam prep. This would be beyond that foundational level to really focus on professional development. Great.
Yeah,
don't forget Q Solutions.
Right. Oh, yeah, Q Solutions also is a wonderful prep for certification. Absolutely.
Yeah, this is Tony, and having been involved in the development of this and watching some of the great work done by the teams, I can tell you some of this material is way beyond me, and I'm a CPHQ. Like it's really designed to help you prepare for an advanced role beyond CPHQ, in my opinion.
Great. We do have a couple logistical questions here. All of the learning labs available, and those will be first on health data analytics starting in July. Each of those learning labs will be available for a live presentation, but they will also be available as recordings in NAHQ's online store afterwards. We can also send this slide deck out to participants after we've concluded for today. Okay.
And one more question about online learning sessions in terms of, so there's not CE available for this session today, but the learning labs will have CE attached.
Right. More information about the Q Essentials Learning Labs can be found at nahq.org/Q Essentials, including registration rates.
Okay, and then there's a question, can a non-CPHQ take one or more of the competencies? So the competencies, just so a point of clarification, the competencies are really a professional development pathway. We do not have a certification exam associated with the competencies. So at this point, we don't have a certification exam associated with the competencies. So you need not be a CPHQ to take advantage of the competencies and really going in, looking at those and assessing where you fit in comparison to the advanced and master practitioner space. You can definitely just peruse that at any time and really use it as a self-reflection tool. And then if you identify that you could use some professional development and learning in any of those spaces, you can then turn to NAHQ to learn from our learning labs. Eventually, we plan to have self-assessments in this space. We do have the National Quality Summit on Population Health, and eventually our conference will be folding in a lot more of this material, which will be available, the conference in 2017. So you can expect a growing offer to our members to help you, get solid on these competencies. As Tony stated, even individuals who are part of the work groups identify their own professional gaps, and this is really about taking things to the next level and really positioning the profession as a group of professionals that are supporting healthcare quality, both at foundational levels and advanced levels, all the way up and through the C-suite and every sort of step and direction on that journey.
Another good question from the audience is, how did the Q Essentials Development Group determine which two competencies to focus on first?
Oh, I can answer that question. Why did we pick data analytics and population health first? For the past few years, NAHQ has continued to seek feedback from members about what were the biggest anxieties that they had in their professional setting or gaps that they had in terms of needing professional development. and consistently data analytics ranked #1 in the feedback that we heard from our members, followed closely by population health, which is also emerging. I'm sure your inboxes are filling up with all sorts of offers from different organizations on population health. That's emerging as a really hot topic right now. And so those are the reasons why those were picked first. Also, NAHQ had the least amount of information for our members on those. So we have deep roots in regulatory and accreditation and things like that, and our Q solutions and different activities, really kind of get into some of the other dimensions at a foundational level. But data analytics is something that really was a void, and we wanted to get in there and fill it as soon as we can because we knew our members needed it.
Great. That concludes the questions that we've received today. If you do think of anything else, please feel free to send feedback or any questions you have to qessentials@nahq.org. Thanks, everyone, for joining us today for this introduction to the Q Essentials. We're very excited about this, and we hope you are too. Thanks again, and have a great afternoon.
Thank you.